Hi, my name is Rochelle Rodriguez, and I am here to give a description, talk about what duties and what it takes to become a flight nurse. Flight nurses are specialty nurses or pre-hospital nurses that transport patients to medical facilities via aircraft. They deal with trauma patients, which is a unit within the ER. However, it is more extreme and need medical attention for immediate survival. They work as a team with pilots, medics, and flight physicians. They can provide transportation from hospital to hospital or from other incidents such as a car accident, potential drownings, and babies in respiratory distress. Other duties include documenting and tracking patient conditions and maintaining crew procedures. They work in a much smaller workplace with fewer resources than a regular RN. Their job duties include using equipment to resuscitate the patient if they stop breathing or if their heart stops beating. They stabilize patients with medications, administer fluids, assess the patient's condition for life-threatening situations, and they also help the pilot with flight duties, such as radio communication. In the civilian setting, they work for hospitals and trauma centers. The majority of their work is done in either a helicopter or a plane. They also work with fire departments, search and rescue units, and independent medical groups. On the military side, they have to complete several weeks of military training and spend the majority of their time overseas on military bases. Flight nurses rescue and transport soldiers who have been injured in war. In order to become a flight nurse, you first have to obtain your BSN or a Bachelor of Science in Nursing. After graduating, you'll have to sign up to take the NCLEX, and if you pass the exam, which is a national exam, then you become a licensed RN. However, if you fail it, you can retake it, but you have to wait 45 days after your original try. The NCLEX is a computer-based program with a maximum of 265 questions and 6 hours to take it. Once the computer is 95% sure of a fail or pass, they will end the exam. That means that the majority of people never have to take the full exam. A minimum of 3 years in critical care is required along with multiple certifications such as the basic life support for healthcare providers, advanced cardiac life support, and pediatric life support. Those are both from the American Heart Association. Others include National Association of Emergency Medical Technicians, Pre-Hospital Trauma Life Support, or the International Trauma Life Support. All nurses are required to hold an advanced certification within 2 years of being hired. Lastly, some states require additional state-specific requirements. Those states include Illinois, Texas, Kentucky, and Arkansas. Some of those states require an EMT certificate. You can find employment within the United States, Europe, Australia, and the Middle East. However, the majority of job opportunity for flight nurses are within the U.S. Because flight nurses are highly specialized, they have very low turnover rates and not as much opportunity for demand as regular RNs do right now. The Association of Air Medical Services and Air and Surface Transport Nurse Association are two organizations that support the field. Flight nurses make more than regular RNs, however their salary is determined on location and the amount of experience that they have. If the individual has trauma experience, they can make up to $100,000 annually. And according to Nelson, which is one of my references, states that they can make anywhere from $50,000 to $120,000 annually. Here is my timeline for becoming a flight nurse. I plan on graduating after the summer and starting USF's nursing program. I talked with a nursing advisor and my prerequisite class GPA is a 4.0. She said I was competitive and to start practicing for the interview process, so I'm excited about that. Once I finish the program and pass the NCLEX, I'll begin achieving my experience to become a flight nurse. Hopefully, by 2026, I will be a registered flight nurse. Lastly is a list of references which I used to create this PowerPoint.